In this video about radiation therapy, I will be using terminology that may be unfamiliar to many patients. If anything is unclear, please take a moment to refer to my website, centerforbreastreconstruction.com, and to some of the other videos in this series addressing these topics more specifically. Radiation therapy can be an important part of breast cancer treatment because it reduces the chance that the cancer will come back. But radiation is not without side effects and consequences. Radiation damages tissue, and it can cause issues in the soft tissue of the chest. These issues manifest in tightness and inflexibility of the skin and muscle of the chest. Sometimes there's a noticeable discoloration of the chest skin. These issues may cause functional problems or discomfort, and it is important to know that radiation is a risk factor for any type of breast reconstruction. If a patient is undergoing surgery for breast cancer and knows she will be offered radiation after mastectomy, she should know that radiation will affect the reconstructed breast. There are different issues that can arise after radiation for different types of breast reconstruction. In implant reconstruction, since radiation causes fibrosis and tightening of the skin, radiation can increase the chance of a common complication called capsular contracture. Capsular contracture is a condition in which the normal scarring around the implant becomes hard and tight. This can be uncomfortable, painful, and even can cause a visible deformity. These issues may require further surgery, like implant exchange or fat grafting. Patients should be aware that if fat grafting is used to address implant complications, the donor area from which the fat is taken may be rendered unusable for any type of flap procedure in the future. This can be very problematic if the implants continue to cause issues and ultimately fail. The patient may have limited options for autologous reconstruction to replace the failed implants. Patients should also know that implant failure is common and occurs in approximately 40% of all patients. If the patient is having autologous breast reconstruction, meaning using her own body tissue to reconstruct her breasts, problems with radiation can still occur. But these problems are much less common and much less problematic. Radiation in autologous breast reconstruction can result in fibrosis or shrinkage of the reconstructed breast. If this happens, these problems can be addressed relatively easily with minimally invasive procedures like fat grafting. If a patient has already been treated with radiation and is considering breast reconstruction or is considering a revised new breast reconstruction operation, we recommend that she wait 6 months after the end of radiation therapy before the next operation. Even after waiting 6 months for the next surgery, patients should know the risks and challenges associated with prior radiation. Because radiation typically makes soft tissue of the chest less pliable. It becomes challenging to provide expansion and implant reconstruction. The tissue is prone to contracture and tightness, and the risk of complications and failure is very high. Autologous tissue reconstruction mitigates these problems by bringing in soft, healthy, well-perfused skin and fat to the damaged area. This can have a healing effect on the damaged tissue and may improve symptoms of tightness and immobility. However, because of the radiation, it may be necessary to bring in more skin and fat from the donor site to reconstruct the breast than would otherwise have been needed. One question that frequently comes up is what type and whether or not to proceed with breast reconstruction if the patient is likely to have radiation after the mastectomy. This is a tough question to answer, so it is important to understand the pros and the cons of the different options. If a patient is having implant reconstruction, it is important to know that radiation may cause contracture of the expanders, and it may make expansion more difficult. And this may delay the final placement of the implants. If the patient is having autologous reconstruction, the patient should know that radiation may cause shrinkage or fibrosis of the new natural breast reconstruction. The alternative is for the patient to have no reconstruction at the time of the mastectomy and seek reconstruction 6 months after radiation is completed. This can mitigate any of the potential problems of radiating a reconstructed breast as described. But the patient will have to live without a reconstruction for up to a year, knowing that there will be another reconstructive procedure in the future. At that point, the surgeon may be limited as to the quality of the reconstruction achievable due to the damage from the radiation. Therefore, the overall recommendation for patients who have had or will have radiation is for some type of autologous reconstruction as opposed to implants. My recommendation is to have autologous breast reconstruction even if the patient will be receiving radiation. This approach provides immediate breast reconstruction, and we know that any issues that may occur can be treated relatively easily with minor surgery in the future. If anything in this video is still unclear, or if you have any further questions, please check out my website, centerforbreastreconstruction.com, or look for other videos which may be more specifically related to the topics of interest.